Well, thank you very much. It is a real pleasure to be back where it all started. And I've attended many great seminars in this room, so there's a lot of pressure on to make sure this one lives up to the expectations. So this talk is about an issue which anybody dealing with data on humans basically is going to face, missing information. And even if you're not in social science, I think this is still an issue. Climate research, for example, those guys also face similar problems, I think, with missing information that the social scientists face. So this is not going to be a talk about economics per se, or even really, I think, social science. It's going to be a talk about methodology. But having said that, it's not a technical talk, or at least it's not designed to be a technical talk. So anybody who's worked with survey data will know that missing data is a common issue, particularly in fields like labour or health economics. The important thing is that this can have a big impact on your results, and consequently how we understand the world. So practical examples of how missing data arise in practice include something like attrition in panel surveys. So maybe you observe the individuals at the start of the period, but they drop out. Sometimes people will decide not to answer particular survey questions. So if you had Donald Trump, he might not answer a question on income, for example. Sometimes people opt out of whole modules. So some of the examples that I'm going to be talking about, people decline to participate in whole sections of the survey. Now sometimes you'll have individuals who don't answer particular questions, but sometimes you can be missing whole cohorts. So the classic example of this in labour economics is you're interested in the effect of education on wage, but you don't have wage information on the people who aren't in work. So if you just a naive look at the data, you would see that you're missing information for everybody out of the labour force. This is particularly problematic because we never get to observe, or almost never get to observe, the outcomes for non-respondents or non-participants. So you can see why this is problematic. So we never get to assess the assumptions that we use for dealing with the data, or easily assess the potential biases associated with different approaches to analysing data sets with missing values. So there's a very close parallel here with causal inference. So think about the potential outcomes framework. So from that perspective, all problems of missing data are really problems of causal inference and vice versa. So because it's so difficult to verify our assumptions and potential bias, I think this has led to a reliance on methods which are seemingly widely applicable. So methods that can be mechanically applied to a lot of different data sets. But in reality, these methods that are commonly used impose a very strong, untestable, and often unrealistic assumption, which is missing at random. If you're not familiar with some of these terms, don't worry, I'll do a quick recap in a few slides. So the first thing to say is that there's no straightforward solution here. This is just a very difficult problem to deal with because, like I was saying, we almost never get to verify what the true outcomes actually are. So there's no straightforward solution, especially when you're trying to correct the problem after the fact. Having said that, I think that this missing at random assumption that we typically impose is often very hard to justify. So I think we can do better. In particular, we can think about the way that we design the surveys in advance to try and correct for this problem, if we anticipate there will be missing data in our surveys. I promised a review of some of the terminology. So this will differ depending on the discipline you're from, and some of these terms might be slightly different. But broadly speaking, we can categorize missing data into three different categories. The first, you might call completely missing at random. So an example of this is you're collecting biomarker samples, for example, and there's a lab accident. So you drop some of the samples, that means that some of the samples are missing from your final data set. Now this is an accident, so it's just completely at random. There's no difference between the characteristics of the people who have their samples versus don't have their samples. So that's the ideal situation. If your data are like that, you can potentially ignore the problem, so you can just analyze the data set using the information that you have. Now that's not efficient, you should probably impute, but if you do ignore it, it's not going to bias your point estimates. Second case, missing at random, sometimes called conditionally missing at random, or missing at random conditional on X, is when once you account for the observed characteristics of the people in your sample, you can get back to the completely missing at random case. So for example, you might be doing a survey, you try to contact people in different locations, and you find it's harder to get the people in rural locations to participate in your survey. Now, once the only reason why people are opting out of the survey is because they live in rural locations, and you can measure that and adjust for that, you don't have a problem, because you can use a standard method like imputation to get back from mark to case 1. So we know how to handle those types of situations. That's great. The real issue is with the final one. You can turn that non-ignorable missingness. So an example of this is, let's say you conduct an intervention and your outcome is going to be the test scores of children in a particular class. So this might be, for example, an intervention on class size. So you say to the kids, right, we're going to conduct an evaluation tomorrow, we're going to have an exam, and you look forward to that, but when you come in the next day, you find that 20% of the children are missing. So the question is here, well, can we adjust for this missingness in a way that makes it plausible there are no systematic differences between the kids who do test and the kids who don't? Now, I'm not suggesting that I've ever done this, but if you're a kid and you're worried about failing an exam, it might be more likely that you don't go into school. And is there any way to adjust that by measuring characteristics of the children? And possibly not. So if that's the case, you have non-ignorable missingness, and we can't use those standard imputation type approaches. So as I'll talk about, a potential solution here is a selection model. But essentially the idea is that selection bias is a manifestation, can manifest itself in missing data. Essentially the characteristics of the people who are in your data set differ systematically from those who are out of the data set, then you have a pretty serious problem. Now if you assume that the data are missing at random, it's pretty straightforward. We have a series of methods that have been developed for dealing with this case. So multiple imputation, inverse probability weighting, propensity scores, and actually all of these are pretty complex methods. But from my perspective, they all have the same problem. They all have the same underlying assumption, which is that once we account for observed characteristics, data are missing at random. Remember that we can't assume, or we can't test for this, so we have to impose this assumption. And what I'm going to talk about in this presentation is that this assumption is likely to be especially unrealistic in contexts in which people have an incentive not to participate in your survey. And it's not just that our point estimates are going to be biased, it's also that we're going to be way too overconfident in how much we know about a particular topic. So our confidence intervals are going to be too narrow because when we use a missing at random type assumption, we're basically saying that we know what the selection mechanism is. So our confidence intervals are going to be too narrow using this type of approach. So the good news is that there is a potential alternative, which is this type of Heckman selection model. But the issue is that they're not very frequently used for missing data in practice. And there's a couple of reasons for this, I think. So the first is that they require a selection variable for identification. So this is basically an instrumental variable type variable, something which predicts whether the person participates, but doesn't affect the outcome in another way. And secondly, because in practice, especially when you binary data, you have to make some sort of parametric assumption about how the error terms in the participation and outcome equation are specified. So again, if this is new to you, don't worry, I'll briefly explain what I'm talking about here later on. So I think because of this, because of the criticisms of selection models, it has led to this reliance on methods which impose missing at random. That's not to say that selection models are perfect, but I think the balance is not quite right at the moment, and I think that we can do better. So what I'm talking about today is really part of a broader research agenda where we try to do three things. So we've some statistical and methodological developments where we try to extend the model to relax some of these assumptions. And the second thing we've done is look at applications of this approach. In particular, we make the case that participation incentives and the way surveys are designed, so survey metadata, are actually plausible selection variables which can be used in these types of analyses. And then finally, I think the most interesting thing, and I'd really like to get to this today if I have time, which is combining survey design with these selection models in mind. Okay, so this is really where my interest in this topic started, which is just trying to measure something which seems pretty straightforward, trying to figure out how many people have HIV. So every couple of years you see a report like this, where UNAIDS comes out with estimates of people living with HIV. This is from 2011, and you'll see that there are estimated to be 34 million people living with HIV. There's an associated confidence interval. Now, in some of these countries, the high-income countries, these estimates are collected through registration. So basically, if you have HIV, it's mandatory that it's reported through the central healthcare system. But in countries in sub-Saharan Africa, for example, it's quite hard to get this data. So what happens is that people conduct household surveys, which are nominally nationally representative, and then they collect blood samples from people at the end of standard socio-demographic type interviews. The problem, as we'll see later on, there's a lot of missing data. So in some of these surveys, 50% of your sample are not participating in the HIV test. So I think that seriously undermines the accuracy of these types of numbers. A similar issue, let's say that we're wondering how many people have hypertension in Ireland. Maybe specifically, how many people over the age of 50 have hypertension in Ireland? Well, again, there's some good news. There's a new survey, new nationally representative survey, which collects objective information on blood pressure. So we can actually categorize people in an objective way to determine whether they have hypertension or not. However, we have a similar issue. Only about 70% of people are participating in the health assessments, which raises the question, well, is it reasonable to expect that we can adjust for people opting out of the health assessment based on what we know about it? Alright, so now let me get into talking about this issue of missing data in HIV research in more detail. The first thing to say is that these estimates of HIV prevalence are extremely important from a policy perspective. So testing is really at the cornerstone of efforts to control the epidemic. So for example, if we want to know about the health status of a country's population, the health needs of a country's population, where to devote resources to, we need to know where HIV prevalence is and how it changes. Also, if we want to evaluate an intervention to reduce the transmission of HIV, we need to have accurate estimates of HIV prevalence before and after. Things used to be very bad for these numbers. It used to be that, for example, in South Africa, HIV prevalence estimates were taken from women who were presenting at antenatal clinics and then extrapolated to non-pregnant women and men. So now we have, it's good news, we have nationally representative household surveys which collect blood samples from people at the end of interviews. The problem is that we have low rates of participation. So for example, in 1 year in Zimbabwe, in one of these surveys, 37% of people declined to test. In one of the surveys that I'll be talking about, we have participation rates of less than 50%. So the real question here is whether the HIV rate among those who decline is likely to be different from the HIV rate among those who test. And there are different mechanisms for this, but I think the most serious case is if HIV status itself predicts participation in the survey. So imagine this, that the outcome you're trying to measure actually affects whether someone is in your data set. So this is the most serious case. So this would happen, for example, if people who know they're HIV positive and fear that others will find out, opt out of the survey. So they fear disclosure. It's not just they know their status, but they might suspect they're HIV positive. We have the same type of problem. Unfortunately, there's some evidence to suggest that this is the case. So you could just ask people. You could ask people, why do you not want to participate in a blood test? This is some data from Malawi. Basically, if you add this up, you find that 60% of people say that they don't want to test because they're afraid of a positive result, they previously tested, or they know their status. You see here that 25% of men say they need more time to think. I think that's giving them way too much credit. That's the type of answer I'd give if I just wanted people to go away. And so I think you have to be a bit skeptical of these self-reports. But nevertheless, if you ask people, this is the type of answer that you get. Another reason to be worried about this, if we looked at rates of previous testing and the current refusal rate, we see that there's a positive relationship. So this is for women, this is for men. On the y-axis here we have the refusal rate. On the x-axis, the percentage of people who had previously tested. So we see that locations in which more people had previously tested and consequently know their status are the places in which people are more likely to refuse. I said that we almost never know the missing data outcome, but there are some specific cases where we do. There are some longitudinal surveillance sites, and there, these papers have found that it is indeed the case that people who are HIV positive are less likely to consent. So one paper finds that people who are HIV positive are 25% less likely to participate in testing. Now, if we knew that this was constant, so if it was just 25%, we could use Bayes' rule and back out a correction for this problem. The issue is that it seems to vary depending on the context and also even within the same survey over time. So I think we're not confident enough to just apply uniform correction to this problem. Those numbers that I showed you are based on the official recommendation, which is just to impute the missing values. So this is, remember in surveys we have a lot of other information. So we know age, education, lots of stuff about these people. And in fact, the participation rates in the interviews are very high. So usually over 90% of people do the interviews. It's just when they come to the blood test afterwards, that's when they decline. So imputation, let's say we know someone's education, we know their age, we know the relationship between age and education from our data, and HIV in our data set. So we predict missing HIV based on what we observe. So remember, we have this ignorability assumption here, that there's no unobserved variables which are correlated with HIV status in consent to test. The interesting thing is if we look at the imputation results, and the results where we just analyze the data set as if we know missing data, they're almost always very, very similar. So this is exactly what you would expect if it's the case that the missingness is driven by something outside the data set like HIV status. And again, the good news is that Heckman type selection models can potentially account for this. Let me take you through now the application of this approach to a particular data set. So this is the Africa Health Research Institute surveillance cohort, which is based in rural KwaZulu-Natal in South Africa. And it's essentially a continuous population survey, which has been taking place since 2001. So basically all residents of the particular area have been participating in the survey since this time. So a continuous population survey sounds a bit nefarious, but it's conducted with close involvement with the local community. It's a very rural location, but also incorporates some town parts, and it's also one of the poorest areas in South Africa. It's a very interesting data set, and there have been a lot of influential papers published from this data set. So these two here are in Science, and they have been very influential in describing how the rollout of antiretroviral treatment can improve life expectancy and reduce transmission rates. And this is a description of where the study area is, just north of Durban in South Africa. And typical scene looks like this. So this is just a snapshot of the data in 2010, the year I'm going to be using. And you can already see that we have major, major problems here. So in total, 17,000 women in the data, but only 45% consent to tests. There are 10,000 or 11,000 men. Only 33% of men take the HIV test. Now, if you were to ignore the missing data, so just look at HIV prevalence among those 45% and 33%, HIV prevalence is very high. So 27% among women and 16% among men. Let's say that you're not willing to make any assumptions. You want to have the omelette, but you don't want to break the eggs. What can you do? Well, you could try a bounding approach. So you could say, well, what happens if I assume that everyone who tests is HIV negative, and then I assume that everyone who tests is HIV positive? So this is these bands here. So this gives you some sense of what you can learn if you don't want to make any assumptions. And basically, it's completely uninformative. The extent of missing data is just too large to help you at all. So what can you do? Well, you can impose this missing at random assumption if you believe it's reasonable that you can account for the missingness based on what you observe, or you can try and implement one of these selection models. So for those of you who aren't familiar with this approach, it's essentially a simultaneous equation model where you model both consent and HIV status at the same time. So basically our outcomes, the two outcomes here, the participation and HIV status, are going to be a function of our observed characteristics. These are going to appear in both equations. And then remember, we need this selection variable which only predicts consent to test. In the classic Heckman type selection model, the key parameter is going to be the correlation between the error terms, which is essentially a measure of the unobserved dependence or the selection bias. When our outcome is binary, as in this case, because it's HIV status, If you assume bivariate normality, that implies a bivariate program. So the equation, the two simultaneous equations look something like this. So we have consent and HEV status as a function of our x's, and with our, I always have to be careful to say z and not z. It's a bad habit I picked up. Z appears in the consent equation only. So these have stars here because these are latent variables. Remember, we only observe the binary evidence. And of course, the key issue here is that HEV status is only observed if consent is equal to 1. Now, this assumption of joint normality is something that some people have a very big problem with. And I think it is important to state that when you have a binary outcome, it is necessary to impose some sort of parametric assumption on the model. So you might have heard that for continuous cases, you have semi-parametric and non-parametric selection models. When your data are binary, it is necessary to impose some sort of parametric assumption. So what we've done is we've relaxed this using a coupler approach, and we also have other ways of relaxing some of the other assumptions about how you specify the model. Those are really papers about the statistical methods, and I'd be happy to talk about that. What I'll say for this example is that we find that it makes very little difference for this particular application. So remember that we need a selection variable for identification here, and that it's difficult to validate these assumptions when our data are missing. So the argument that we've been making is that survey metadata are plausible selection variables, because they almost always affect whether the person takes part in the testing. But I think it's reasonable to assume that they're plausibly unrelated to the characteristics of the individuals. So what we're proposing here is that interviewer identity is suitable. So we can actually test in the data whether the interviewer you get affects whether you take the blood test or not, and it almost always does. In fact, I've never seen a case where it doesn't. But we can't validate this second one empirically. So is it reasonable that the interviewer that you are assigned to is unassociated with your unobserved characteristics? Here, in particular, your propensity to be HIV positive. Well, at a minimum, it's great because interviewers can't change your HIV status, except in quite a specific circumstance that we'll just gloss over. But let's say you can affect your HIV status. That's not to say that interviewer allocation has to be uncorrelated with your HIV status. So you can think of situations in which interviewer allocation is associated with HIV status, for example, sending interviewers to hard locations or easy locations. So I think it's important to evaluate this in every survey that you're thinking of applying it to, but I know this context pretty well. So in this particular survey, interviewers are assigned to geographic locations, and they move around from house to house, basically trying to contact all respondents in those households until their job is complete. So in this case, I'm reasonably confident that interviewers are uncorrelated with the survey participants' characteristics. Now that's not to say that that is unconditional. So we do know that, for example, female interviewers tend to interview female interviewees. Language is also generally a matching variable. But once we observe that, we can adjust for it. And so I think interviewer identity is potential and may be useful depending on your knowledge of the particular survey that you're thinking of. Here, I think it's reasonable. Still not perfect. So the nice thing about this data set is that we've got a second selection variable. In this particular year, in 2010, it was a gift intervention. So this is almost an ideal opportunity to validate the model. I say almost ideal because I'll explain how we're trying to improve on this at the end. So the idea here is that we've got two different selection variables, both of which are likely imperfect, but we can implement selection models using both, compare the results, and we'll also be comparing the results to the more conventional missing at random type approaches. So what we're going to do here is we'll have new point estimates from these selection models, and we'll also have new confidence intervals. So this gift took place in 2010. Because of the low response rates, the research team were very concerned about increasing the consent rates. So in conjunction with the local community advisory board, they decided to have a gift intervention. So essentially a food voucher, which was worth roughly £3 at the time, the way sterling is going, it'll be worth 300 in a couple of years. But this was assigned to a subset of households in the 2010 survey. The original idea was that this would be an RCT, but for whatever reason that ended up not being the case. It turned out that all households in the last 10 weeks of the survey were given this gift voucher. So this is at the household level. So in other words, it was given at the first contact between the survey team and the people in the household. It was also unconditional. So literally the survey team would knock on the door and give them the voucher, and then ask if they wanted to take part in the test. So you got the voucher regardless of how many people in the household participated. In total, that's about 16% of residents who were in a household which received the voucher, or 3,500 people.
So,
yeah.
Can you please confirm, is it that they got the voucher for doing the blood test or doing the survey and blood test? You said they knocked at the door, gave the survey, so.
Yeah, in this particular case, there was actually no interview. There are two things happening here at the same time. There's two independent surveys: the HIV surveillance, which is this part here, where there's only the blood test being asked for. At other times of the year, there's a household interview, which is where I get the other information from. But in this particular case, there's no other interview.
And they went. So someone. Is it only people who did the interview that they do the blood testing?
No. The interview is mainly with, it can be conducted with a household informant, so it doesn't have to be with the individual. Yeah. Other questions? Okay, so just briefly to describe the effectiveness of the voucher, I'm showing you for men and women in the control and intervention groups, the change in consent rates over time. So this is the control group, this is men who are in households who did not receive the voucher. You can see there's this small increase over time from, I guess, 30% up to 35%. Likewise, for women in the control group, a small increase over time. However, if you look at the intervention group, you see there's this big jump in consent rates. So we do a more formal analysis of whether this was effective, and we find that on average, it increased participation rates by 25%, inch points. So that's good. We can now use this in our selection model. I promised, for those of you who weren't familiar with this approach, a little explanation about how we're going to use these selection variables to adjust for missing data. So in this graph, I'm showing you, for each interviewer, the proportion of respondents for that interviewer who accepted the test. So this is on the x-axis here, this is the success rate. And on the y-axis, among the interviewees for that interviewer who consented to test, what was their HIV prevalence rate? So for example, for this interviewer here, 20% or so of their respondents agreed to test. And among those who tested, 30% were HIV positive. So you'll notice that there's sort of an upwards trend in this graph. In other words, the interviewers who are more successful at getting people to test have higher estimates of HIV prevalence. So why would this be happening? So if you buy the assumption that interviewers are randomly allocated, the only reason this would happen is if the good interviewers manage to persuade the people who would ordinarily refuse into testing, and those people who would ordinarily refuse have higher rates of HIV prevalence. So essentially our estimate of selection bias is the difference between the HIV prevalence estimate for the bad interviewers and the HIV prevalence estimate for the good interviewers. So basically 30% versus 25%. Now this is just a simple scatter plot. We need to model this formally, which is what I'll do when I show you the regression table. Likewise, we can think about this for the gift intervention, and I'm showing you the same thing, HIV prevalence among the different groups who received the voucher versus did not receive the voucher. And you can see the same pattern. So for men in the control group, HIV prevalence is around 15%, but it's much higher if you receive the voucher. Likewise for women. And again, the same argument. If you buy the assumption this is randomly allocated, the reason this is happening is that the people who would ordinarily refuse, but were persuaded into testing by getting the voucher, are more likely to be HIV positive. In other words, in this case, I think we'd have to worry that there's some selection bias here.
Is it not a matter of who is persuaded with the testing?
Yeah.
You can imagine an interviewer saying, having a sales pitch that's really aimed at people who have HIV, saying, or who are high risk.
Yeah.
Saying, we really need to know because we can help you with treatment or something like that. Or you can think of an interviewer having a very different sales pitch saying, you'd never have HIV, you're safe to do the test.
Yeah. Yeah, so I guess this is sort of analogous to the issue with instrumental variables. And here I'm assuming that, yeah, people are homogeneous and that the effectiveness of the interviewer doesn't vary by propensity to be HIV positive. It's hard enough to try and deal with the selection bias issue without worrying about heterogeneity. So I think it is a very important point. The nice thing about this example is that I've got two different selection variables which are, I think, incorporating very different mechanisms. So if I get the same results from both, I think that's some comfort, but you're absolutely right that this is an assumption I'm making.
Mark?
Yep.
Do some people in the sample already know whether or not they're HIV positive?
Yes, they do. Yeah. And we could ask them about that, but again, I worry about whether self-reports are useful. But yeah, there definitely are a substantial proportion of people here who know their HIV status. I just show you the control variables that I have here to make the point that we do actually know a good bit amount about these people. So age, education, actually distance to a road is a good indicator of socioeconomic status. So education, marital status, and so on, we have this information. So these are the results for men. So the first line here I'm showing you is the estimate where I just ignore the missing data. So I just say, what if I analyze the data set as if there's no people opting out? So then my estimate is 16%. I have a confidence interval, you can see that it's pretty narrow. So it's 14 to 17%. The second approach I can do is to try and impute the missing data for those who don't test using those observed characteristics. So there, you see I get a very similar point estimate, 17%. Also very tight confidence interval. The next three lines show you the different selection models based on the different selection variables. So the first one here is using interviewers. The next one here is using the gift, and then a combination of the two. So what you see is that we get estimates of 21%, 33%, and 21%. So a good bit higher than our more conventional type estimate, suggesting that the people who are opting out of testing are more likely to be HIV positive. But it's very important here to look at the confidence intervals. You see that the confidence intervals for the selection models are much, much wider. So essentially, with these methods, not only are we imposing missing at random, but we're saying we know for sure there's no problem with selection bias. Whereas the selection models incorporate the potential for selection bias. So I think our conclusion from looking at the men would have to be maybe there's some suggestion that HIV prevalence is higher than we thought, but really this is saying that we know much less than you would think just looking at our observed data set. So I'd be very cautious about interpreting these numbers. Yeah?
Do you know what your estimate is if you use IPW?
Yeah, I mean, there's a whole suite of methods here that you could use instead of imputation, and they're all the same.
Do you get the same answer?
Yeah. Yeah. And this is not at all surprising if it is actually an issue of people opting out because they're worried they're HIV positive. There's just no way for imputation or any of those other methods to account for that.
It depends on how many actually variables you use, though, to predict. I mean,
Yeah.
You know, if you've only got 5 or 6 predictors of attrition or missing data,
Yeah.
if you've got 500 variables, it also, you know, you can't just say it's, you know, it really does depend how many actually predictors you have, and if you do a really rich set of predictors, actually you can do a much better job than if you only got 4 or 5. So, how many variables are you using to bring in the imputation?
I'd say there's at least 20. There's at least 20. I mean, the issue is, if it really is... Sorry?
The more of those you have, the better.
Sure, but it may not even be about the amount of variables, because if it's really propensity to be HIV positive that's causing people to opt out of the data set, you can measure the relationship between, say, marital status and HIV status for people in your data set, but that still doesn't tell us about that relationship among the people who are missing. So it could be, if you think about an extreme example where almost everybody in your data set is HIV negative, then it's going to seem like there's no relationship between marital status and HIV status. But that's simply an artifact of the missing data problem. So including more variables like that wouldn't necessarily help you.
But if you include more variables, that would be...
Well, how does that come around to selection bias? Not just that there's no solution, just sticking more variables.
Well,
so
if
that
you
same
have,
selection
yeah,
process.
but if you have variables that actually do predict whether or not they're going to be the sample or not. So the idea is that there's unobserved characteristics that predict whether or not they take part or not. But if you actually measure an awful lot of those variables, if you can actually measure.
Well, all you're saying is if selection bias isn't a problem, then it's not a problem. That's all you're saying.
Well, I think the more, if you, in this case, I don't think it would be particularly useful, but in other cases, if you actually can measure the propensity, if you have full information, not full information, you do an awful lot of variables that get at the underlying characteristics.
Yeah, you're saying selection isn't a problem. That's
okay.
Well, I mean, just think about the issue here, which is that, and we'll see this with the hypertension example later on, that people are opting out of the survey because of the outcome. So if that's the case, there is no other variable you can use to measure them. But I take your point that if there may be some way of capturing, there may be some very simple examples where you could capture the unobserved dependence in some way. But I don't think that applies here. Okay, so that's for men. Looking at women, again, same thing. Cases with a valid HPV test, 27%, 28% using imputation. And now here we see, again, the same thing, much higher rates of HPV prevalence. In this case, the confidence intervals are still much wider, although here they exclude the original point estimates. So here I'd be slightly more confident in saying that HPV prevalence is likely to be more in the high 30s than it is in the mid to high 20s. So some evidence of selection bias for women. The complete case analysis and imputation results are equally bad, for reasons that we've discussed. The interviewer and food voucher results are broadly consistent. A very important point is that much larger selection model confidence intervals. So I think that at a minimum, we have to acknowledge that when there's a substantial amount of missing data, when we apply a missing at random type approach, we're really being too overconfident in how much we can learn from the data, I would say. And not shown here, but results aren't sensitive to the assumption of bivariate model.
How would you test them?
So we have a copyless selection model where we can impose various different distributions, and when we do that, we find the results are basically consistent. Very low change. Now, this is not a straightforward issue. We're still imposing some sort of distribution, but for the copla that we have, we find no difference. Okay, so one second example, how do we evaluate how many Irish people suffer from hypertension? I mentioned the tilde data set, so we can try and measure it there. It's a nominally nationally representative sample. And in tilde, after doing the interview, participants are invited to take part in health assessment. If you look at the health assessment though, what you see is that 72% of men and 72% of women actually participate. So the question is it reasonable here to assume that the data are missing at random once we adjust for observed characteristics? So what I've done here is I've implemented the same type of selection model using interviewer identity. And these are very preliminary results, and I still need to, I've been in touch with Tilda to try and learn about how the interviewers are allocated, so this is more an illustration of the type of application that you could apply rather than being, a set of final results. But essentially, when you apply this selection model, what you find is that there's some suggestion that the men who are not testing have higher rates of hypertension. So this is consistent with the idea that people don't want to do the health assessment or are not able to do the health assessment if they're less healthy. Whereas for women, you see a lower point estimate, but again, very wide confidence intervals. So that's, an illustration of the type of application that you could use. Alright, so now I think getting on to the most exciting part, for me anyway, which is designing your survey to incorporate this approach. So far, we focused on methodological developments for dealing with existing data sets which are affected by missing information. Hopefully demonstrated some type of methods, selection models, which provide consistent estimates even when the missing data are not missing at random. But it's not always possible to apply these methods to existing data sets, and it's certainly not appropriate to apply these methods to all existing data sets. So why not? The main reason is that in practice we require this selection variable, which predicts participation, but not the outcome. So this type of variable is not always available, and it has to be only related to the outcome through its impact on participation. The second point here, we can't test it empirically, we have to assume it. So it all comes down at the end of the day to a qualitative assessment of how reasonable this assumption is. So for example, how reasonable is it that interviewers are randomly assigned? We've made some progress on the other limitations, so I was talking about bivariate normality. And again, that's still an issue, but I think we've at least made some progress there. So the ideal selection variables are going to be exogenous to respondents. So the candidate variables which are within the control of the participants are generally not a good idea. So for example, the timing of the interview, maybe people who get interviewed at night are less likely to take part in the health assessment or answer questions on income. Is that a good idea? What if there's somebody else in the room? Maybe that affects whether people answer questions. But they're in the control of the respondents, so it's probably not a good idea. So for example, the households where husbands and wives are interviewed separately versus together, they might be different from households where they're not. So that's probably not a good idea. The reason that we emphasize survey design is that at least these elements are beyond the control of the respondent, and from that perspective, they're more likely to be exogenous. But like I was saying, interviewer allocation could be done in such a way that interviewers are correlated with the outcome. For example, I'm the survey manager. I send my good interviewers locations where I expect response rates to be low. So if you have information about that, then that's great, but it's not always appropriate. So the only guaranteed selection variable is one which is conducted in a randomized controlled trial. I think our work has three implications for survey design. So the first is that how the survey is implemented is likely to have a much bigger impact on participation rates than you would think. So in every survey that I've looked at, things like interview identity, interview experience, the field office, the time of interview, all of these things have a much bigger impact on participation in the data than you might think.
Interview gender as well.
Interview gender, absolutely.
And nationality. So when they do surveys in Scotland, responses depend on whether it's an English person.
Understandable. Yeah, so I think that there are certainly papers on this, but I think even still, this is underappreciated. So I think we could still do a more thorough investigation of how these factors impact on participation rates. Secondly, for people running the survey, thoroughly documenting the survey protocol in advance and recording this metadata, making it available to the public, I think provides a low-cost opportunity to implement these type of selection variables. So at the moment, for example, in the surveys, we only have interviewer identity as an anonymized code, but if we knew other things like education, gender, language, and so on, I think more opportunities to implement this type of methods, and it's a low-cost way of doing so. Especially useful as if we know our interviewers were allocated. So it's written down in the survey manual exactly the process through which interviewers were sent to respondents, even if it's not random, if we have information on the matching, and that could still be useful here to implement. The final point is that randomization, I think, is a powerful tool in lots of respects, but it's also potentially useful in this context, because the ideal opportunity for dealing with anticipated attrition or non-participation. So essentially, if you're running your survey, if you randomly allocate potential participants to, say, an incentive or just a different recruitment mechanism, if it's randomized, this provides a selection variable which is guaranteed to meet the exogeneity assumption. So yeah, participation incentives, interviewer allocation, mode of the survey are all potential examples of this. And it's not that the randomization has to be over the whole survey. So it might be that you're intensively following up on a particular subgroup. So that's still fine. Once that's documented and we know the ways in which that was done, you can still use this type of randomization as a selection variable. So if you are planning a subgroup analysis, I mean, this should be obvious anyway, but randomize it, and it will be useful, potentially useful, as a selection variable in a future attempt to deal with missing data. Okay, so let me wrap up. I don't want to appear overconfident in the methods I'm proposing for dealing with missing data. It's a fundamentally difficult problem. It's hard to deal with. There are no easy solutions. Having said that, correct treatment of missing data, I think, is vital to our understanding of many policy-relevant questions in public health and social science. Methods which impose missing at random are straightforward to implement, at least in a mechanical sense, but I think oftentimes they require this heroic assumption, which we have to impose and we can't test. Selection models relax missing at random, but they're not always credible. For that reason, I think the strongest potential is when we build these into data collection ex ante. I mainly concentrated on survey data, but this is also a huge issue in randomized controlled trials. So let's say you go to all this trouble of designing a randomized controlled trial, so you have gold standard. The whole point is you don't have to deal with causal inference. But if you're affected by missing data, you're essentially back in the causal inference world. So if you've got substantial amounts of missing data, you have to worry about the validity of the results. So for example, again, talking about just HIV, because that's something I know the research on, there was a recent review of 57 intervention studies. These were trials, for example, medication to reduce transmission from mother to child. What they found was that the average number of extent of missing values per study ranged from 3% to 97%. On average, 26% of the information on the outcome was missing. And none of these studies reported any of the assumptions they made for managing the missing data. So under the assumptions that the authors follow in that paper, only 12% of these studies are expected to produce unbiased results. Yeah, question?
But if missingness is unrelated to assignment, then it should be fine, no? Or there would have to be that the treatment in some way, or I mean, because if the treatment variable is orthogonal to missingness,
sure,
it shouldn't matter for the essential inference that you make, no?
Absolutely, but let's think about these intervention trials. So you have some idea that you have an effective, let's say, drug for reducing the risk of HIV infection. So if that's effective, then the people in the control group are going to be more likely to be HIV positive. And if they're more likely to be HIV positive, and you buy the story that I told about opting out of the data, then that is going to generate a bias. So you're absolutely right that it does depend on the application. And in some cases, yeah, the missing at random assumption could be completely real. Here, I mean, this is somewhat shocking. And the way that we're hoping to improve on that validation study that I mentioned is that we're going to be running an RCT in Tanzania this spring, where we will incentivize bar workers in Dar es Salaam to test for HIV. So we'll be randomizing an incentive, and because this is randomized, we'll be able to compare this with the interviewer selection model. I think there are several low-cost ways of facilitating this approach, not least just making the metadata available with the release of the public data set, a wide range of potential applications. And all of our developments are available in the R package, and we're very keen to see this type of methodology implemented. So if you have any questions, do feel free to get in touch with me. So I'm summarizing several different papers here. The main co-authors, Till Berninghouse and David Canning from Harvard, John Pierre O'Mara from UCL, and Rosalba Radic from UL. If you'd like any of the references, feel free to get in touch. One last slide to advertise, to say that we recently launched CHARMS, which is the Centre for Health Research at the Management School. It's a new research initiative at Queen's, very much interested in developing links with people in UCD and around the south. So very happy to talk to people about that too. Great, so thank you very much.
Great.